Hi everyone, my name is Dr. Pamela Muga, an obstetrician gynecologist in partnership with Ponea Health, and today we'll be discussing antenatal care. Antenatal care is the care that we give to women who are pregnant before they deliver, and it's supposed to start immediately you find out that you're pregnant. So it's always important to see an obstetrician gynecologist once you find out that you're pregnant, because there are certain supplements that we give you that would help to prevent certain abnormalities that your baby can be born with. So it's always important to do that. Why do we say that you need to have antenatal care? Antenatal care is important. For most women, pregnancies end up occurring naturally, proceeding naturally with no problems. But sometimes there are people who might develop problems. And when we do antenatal care, we're able to pick out some of those issues that might cause problems a little bit early. And it helps us to be able to intervene early and therefore manage them early and prevent loss of life. So antenatal care is very important, and it's always important to see your doctor on those regular intervals. Each of the intervals are actually planned and organized so that we're able to call you in and be able to see when those problems are going to develop and intervene before they develop. So when you're having your antenatal care, we kind of divide pregnancy into two levels, the early pregnancy and then late pregnancy. So the early pregnancy would occur just before the baby is able to survive outside. And some of the issues that we'd like to find out around then is if you've had any bleeding, because that could be a danger sign, any low abdominal pains, if there's been any discharge, or if you've had any illness that can cause you to get fevers. Yeah? Some of these can actually cause you to lose the pregnancy. So it's always important to tell your doctor when you attend antenatal clinics and you've had any of those symptoms. There are others that would occur in late pregnancy, mid to late pregnancy. So it's always important to tell your doctor if you've had any bleeding, if the baby is not moving as they usually do, because you being the mother of the baby, you know how the baby moves generally. And so if there's any difference, then you're able to give us that information. So any differences in the way the baby moves, and especially if the differences has reduced. If you're draining fluid, there's that fluid that occurs during pregnancy, and sometimes it can actually start to leak a bit early. So it's always important to let us know about that, or if you're having any vaginal discharge. So those are the danger signs that would occur in early pregnancy or in late pregnancy. Thank you for engaging with me in this episode. You can book our services at ponea.com. We look forward to meeting you in the next episode.